Yeah. So at the very outset, let me bring all wishes and congratulations to you from the entire faculty team of Speed Institute. All the faculty members are very curious and eager, and they conveyed all the best wishes to you, to your family, and to your friends for getting on to the topmost rank in MCH NEET SS 2020, MCH Gynae-Oncology and Reproductive Medicine paper together, and you have scored rank number 1 in the country. And it's a great privilege first to have you with us today and also in the course. So we want to know from you your journey from medicine to your post-graduation and your aspiration for MCH. I mean, I am yet to listen to you which field you are going to in gynecology or reproductive medicine. And during the course of the interview, definitely we will get to know what's your option in both of that specialities. And we want to know your journey from medicine till date.
Yes, sir. So I did my MBBS from Tanjavur Medical College, sir. I was a student of Speed PG entrance at that time. And then I joined MSOG. My aspiration was always to join MSOG only.
When you joined Speed for PG exam?
Sir? For PG entrance.
When you joined Speed for PG? Which year was that?
2012. So I did my UG from Tanjavur Medical College, sir. I belong to the North 6 batch. So actually, immediately after my UG period, I had joined Speed along with all my friends. And I prepared for PG entrance exam with Speed.
Okay.
Then usually there are always people who say, hey, you should join medicine, you should join dermatology, or why don't you take up MDRD and all. I got Tamil Nadu, I got rank 17. But of course, there was MDRD also at Annamalai and all. But I always wanted to take a hardworking field. And I always wanted the thrill and, that adventurous thing where you save patients. I really liked it when I did my house residency. So I wanted MSOG at MMC. That was the only thing that I actually wanted. So I was determined to take MSOG at Madras Medical College and I did that.
Okay.
I joined MSOG at Madras Medical College. Now, since I was here in Chennai, probably because of that, I had extra exposure. I went to a lot of conferences and meetings. I always used to attend all the conferences with my friends. So then my interest began with gynae-oncology. Gynae-oncology has always been a great field for me. So I started preparing for gynae-oncology. Last year, immediately after my PG exams, that is only 20 days after my exams, I gave the first NEET SS entrance, sir. That time, that was 20 days exactly after my MD exams. So that time my rank was 72.
Okay.
So then, now this time I really wanted to get the seat and I was quite so desperate. I wrote every AIMS exams also, which came in between the June wala and the November wala, everything I wrote. And each time I scored more than 50%. And each time I was pretty close. There is only one seat in AIMS, as you must be aware of, for gynae-onco. And we're not really sure how it is there also. But somehow that helped me from where they can ask questions and all that. So that was one point. Now, finally, this time I really wanted to crack it. I wanted to be within the top 5 when I started preparing. And then this application, when it was opened, what happened was I suddenly saw that infertility was joined as a combined paper. This was completely a shock for me. And my husband were like, okay, let's not apply this year.
Okay.
This is so funny. We're not going to. I don't know a word of infertility, practically speaking, because I didn't have a liking. Actually, I was a gold medalist in infertility in my PG period.
Excellent.
But somehow I always had an aversion. I felt that it's a little commercial, is what I felt. It doesn't have to be true, but that's what my feeling for infertility was. So I was determined to take up gynae-onco only. So then I thought, okay, why don't I give it a try? I joined Speed infertility live classes. So I took them all. And then I did a lot of mock tests, which helped me prepare more. And it made me understand where I actually lagged. So that really helped me, sir.
So it was a quick action plan to come back.
Yeah, truly. I allotted exactly 5 to 7 days for infertility. It was a clear-cut plan of what guidelines I have to read, which is the book which can give me the maximum number of points in the minimum number of days.
Okay. Okay. So it all went
helped me and everybody's blessings and friends.
Okay. Now I just want to ask you, of this 100 questions,
yes, sir,
how many were from general OBG? How many are from reproductive medicine? and how many are from gynae-oncology. We need to know the clear split.
Yeah.
So that it will help the people who are prepared for upcoming exams.
Yes.
It will give you a clear vision.
Okay. Among 100 questions, sir, what we were expecting is usual 40 will be from OBG. We thought since reproductive and gynae-onco are combined, we expected 30 from each. So that was the expected pattern. But I somehow in one corner I felt that since the number of reproductive medicine seats are quite less, I thought maybe gynae-onco questions could be on the higher side. And actually that's how it appeared.
Okay.
Among the 60 questions from the super specialty part, at least 40 questions must have been from onco. At least.
Okay. It is not 30.
I think even 45 questions were from onco.
So it is almost 40 to 45 from onco and 15 from reproductive medicine.
Yeah, but the onco part would not differentiate any person who has read his basics in onco and who has completely devoted his time to onco, because the onco questions were quite straightforward. So almost like if you take up 45 questions, anybody who has just finished his OBG can do 38 to 40 questions right.
Okay, it's almost, you're saying about 90% of the questions.
Definitely. But the point is, one who does all the 45 questions in onco correct only enters the competition, because they were all quite easy.
Okay.
And reproductive medicine questions were not like very straightforward. They all involved a lot of clinical scenarios where you should know guidelines, you should know the current guidelines to be more specific, not just books, not just facts. A few of them, definitely a few facts were there, but it was also important to know the current guidelines. And luckily, the guidelines which I had read hadn't changed during my medal exam.
Okay. So your medal exam helped you to give you the insight for these questions.
Yeah.
The maturity of understanding of these questions.
Yeah.
Now let me ask you a question. Now, what is the next plan? I mean, for the rank number 1, it's your choice now. I mean, you have a privilege to.
I've always wanted gynae-onco, sir. Yeah. Last year when I started preparing, I actually wanted only Kidwai. I was planning to take in Kidwai Bangalore because it's close to my house and all that. Now a lot of people say, why do you want to leave a branded institute, Tata Memorial? So I think I'll be going for Tata Memorial, sir.
It's almost I mean what you dreamt of, now dream coming true, and now moving on to the same specialty that you wanted, and you're going to complete it. Now my question to you is a must. I mean, now today that every now it was like every MBBS student want to do a post graduation. Now the trend is slightly moving that every postgraduate student now wants to do a super specialty. And I mean, with reference to people who finish MS, people who finish MD, general medicine and general surgery, there is always an urge to finish in a super specialty respectively. When it comes to OG, now you tell me what kind of mindset is that today for the postgraduates to go for a higher specialty, or you feel that completing MD OG is more than enough to do a good quality work that is required for our country?
So there are two things in life, sir, according to me. One is satisfaction, the other is money. If it is all about money, and MSc OBG does very well in money. You don't need a super specialty for that. All that you actually treat is antenatal patients. For that, you don't need a super specialty. For me, it was satisfaction. The satisfaction to do complex surgeries, laparoscopy, and all that. So for that, I'm already doing my fellowship in gynae-oncology at IOG.
You're done, or you're going to?
I am doing, currently pursuing.
Okay.
So I am actually doing it. I'm almost going to finish a year of that.
So how many years is that?
2 years, sir.
Okay.
2 years. So, I'll probably be. Yeah.
You completed the second year as well now?
No. I have completed 1 year because last year I wrote my first NEET SS. I got rank 72, and through that I got admitted into the fellowship last year.
Okay.
I wanted to pursue my career only in onco.
Okay.
So I entered fellowship, and meanwhile I started preparing for this also.
Okay.
Then I got into this. I'll be discontinuing the fellowship and joining MCH, sir. Because ultimately at one point what happens is however qualified you are, I mean, is all that matters. Fellowship sometimes it's not sufficient. That is one thing, and doing it from a prime institute is definitely a dream.
No, let me ask you this question. What is the difference between the fellowship and MCH program? This is 2 years and that is the 3 years course. I mean, what difference it makes by and large in overall purview?
See, actually, there are a lot of fellowship programs for gynae-onco all around the country, sir. Most of them are based on interviews, written exams, and then followed by interviews. A lot of them have a definite kind of bias. They would like to select their particular state people and all that. And no fellowship course is MCA recognized. So if you want to go out of your state and practice, I think you will definitely need an MCA recognition. To maybe if you want to face something legally, you would definitely require MCA recognition. And doing an MCA recognized course like MCH would be valid wherever we go. So that is one point. And wherever, even joining an academic institute and wherever we need an MCH. And here, the fellowship here, and even in some other places, one thing, there is no MCA recognition, there is no pay, no stipend. So that is also there. But the hands-on here is good.
Yeah. But what is the difference between DNB and MCH in that situation? DNB and MCH.
DNBs are actually, according to practice, it doesn't look very different. A lot of other, see, I've spoken to people from DNB Gastro and MCH Gastro. They all say that working in a corporate hospital or setup, it doesn't make a big difference. But there are some institutes which show some partiality. Maybe a person who does DNB will have to face that at any point of time. If there is an option of MCH, it is always better to go for MCH than DNB. But there are some places like Tata Memorial, Kolkata, where DNB is really good.
Okay.
So that's definitely there. But we have to take what we want. We're going to join a corporate setup, and I mean, it ultimately depends on what we want and not what others say. That's what I feel. If we are okay with our practice and we are joining a corporate setup where they don't really differentiate between the two, that's okay. And one particular point about DNB is a lot of places they don't give enough hands-on. If the place where we join gives us good hands-on, then I think it's not wrong going with DNB.
Now, you tell me, I mean, looking at the level of confidence that you were before the exams, you were telling me that I have planned from 1 to 5. There is a area, there is a level you have marked. I mean, you knew very well that the 1 to 5 will give you what you wanted actually. And this 1 to 5, the kind of confidence level even before the exam, in spite of a very, very hectic and high level of competition, what gave you that mental confidence?
Sir, actually, this time I was so desperate to get a seat. That is one point. I cannot waste another year. That is one point. So what I did was I took a complete analysis of 2018 and 2019. How many questions should I get correct to get into the race? How many questions, if I lose, I will be thrown out of the race? In 2018, a person who scored 93 out of 100 was the first ranker. And the same year, a person who got 90 out of 100 was out of the race. I really mean it. Yeah. This is how even I reacted when I saw the scorecards and all. So I saw that thing, and so last year it was quite similar. So if you get less than 90, you might still not find yourself on the list if it is an easy scoring paper.
Okay.
If it is a low scoring paper, you might still be there somewhere. You might linger somewhere there. But if you want to be the top 10, you should definitely be 90 plus, something like that. That is how it was. This year, because reproductive medicine and gynae-onco were combined, and a lot of scenario-based questions for which nobody could really give out the proper answers, no? I think the score cutoff went a little down. We were expecting the cutoff to rise this year, but the cutoff actually went a little down, some 7 marks down than last year. First year first rank was 375. Last year, first rank person was 352. This year it is 345.
Okay. Now, what was the score out of 100 for you?
For me, I did not attempt 2 questions, sir.
So 98.
Yeah, two questions I did not attempt, and I think 10 were wrong. 10 were wrong. You cannot afford to do more than 10 mistakes in a paper.
Okay.
That is the criteria.
Okay. So it's a clear plan. So, I mean, after the exams, you knew that you will be within top 5 or top 1 or rank number 1.
After the exams, I did not know that this was a low scoring paper.
Okay.
So, and the infertility pass was there. I was expecting a rank between 20 to 60. But based on my confidence, based on the answers that I was telling my husband and all, he was like, no, you will come within 5 to 10. Definitely. My husband was telling, I was like, no chance, yaar. Definitely the topper would have scored better than this. A topper will not do such mistakes. I was telling him. Finally, I didn't expect this. I was expecting a rank between 20 to 60, sir. Because
so the rank 1 came, it was a surprise or deserving? Obviously, it should be deserving.
Sir, actually, based on the preparation that I did, based on the time I spent leaving my family, my kid, staying in a separate room in isolation and studying all the time, and not just one book. I did a lot of books, sir. I was actually greedy enough to do a lot of books.
How many hours you would have spent per day, approximately?
So initially, for 3 or 4 months, I've spent around 3 to 4 hours per day. For the first 3 to 4 months. Then the last 15 days, I spent 10 to 12 days, 10 to 12 hours per day.
Yeah,
that is the maximum threshold. I cannot read more than that.
Yeah, because it is not the same like post MBBS.
Exactly.
It is something the entire family went, and in the situation like in a lockdown, to take care of the family. And in spite of all this, to give this many hours is not that easy.
Yeah.
And it is a very, very, high potential hardworking strategy that I could, I could feel it. And it's something great and unique. And this feeling of being in rank number 1 after a very long period of time, after post MBBS and all those days. And this is a quite different feeling, but it's a kind of a matured sense of happiness that we always feel. And more than that, more than the rank, what we want is more important. And how we want it is very, very important. And you made an exact striking way of getting it done. So people always say, people don't give me, I will take it. So that's how it is. I think you did the same way. You took what you wanted. Yes. And I really congratulate you. What is that you want to tell juniors or people who aspire for gynae-oncology or reproductive medicine? And what they should do?
Yeah, I always, for the preparation, I would always advise anyone to read the same book again and again. Or if you want to read a couple of other books, read the same topic from all the books at the same time, so that you know what extra is given in this book, what extra is given in that book. And the most important thing is to keep revising, number 1. Number 2, to keep working out a lot of questions. Working out a lot of questions, it definitely created a difference for me, because I used to think, okay, fine, I know this topic very well. Then finally, when I actually try to answer a question, I have doubt. Oh my God, I thought I know this question. Then I go look back, converting all the short-term memories into long-term memories. That's how it happened. Revising every afternoon, I had a plan. Like every afternoon, I do 100 questions. I know OBG was difficult. Usually, what everybody thinks is, OBG, come on, I know the subject. I've done my post-graduation in the subject. I know it quite. The questions are like the previous repeats. We have to get them right. We do them. We keep it often. We get so thorough in them. We cannot afford to lose the repeats. So those are the questions which are kind of filtering at the entry point. So doing a lot of questions in OBG, onco, infertility, and doing a lot of questions and revision is the most important thing, sir. Definitely anybody can do it.
So 6 months of preparation will be more than adequate to do this?
Yes.
What is your opinion on this?
It's ideally full time, sir. Because the problem here is the number of seats are quite less. So if you take a chance, we might waste another year.
If that's I'm going to work and I'm in service or I'm working somewhere and I can spend only 2 to 3 hours the maximum. It has to be in a year.
Go for a year preparation, 1 year preparation, because infertility and gynae-onco are combined. Only one of them, it is enough that 6 months. If you read now that both are combined, who knows? Next year there might be a lot of questions from infertility and less questions from onco.
We'll never know.
It could have been, it could be anyway. So we should be prepared for both. We should have read the standard, worked out questions for both. See how it happens next year.
So, we all of us know that the number of people of post MCH and DNB of both gynae-oncology and reproductive medicine, or yes, the number of people coming out as total number of seats compared to the rest of the other specialties. Yeah. And we will always faculties and we will love to have the people who have completed recently, because they would have read end to end and page to page. Yeah. And now, on behalf of the entire speed management and the faculty team, we put an invite officially to you to be as a faculty for this NEET SS program for gynae-oncology for upcoming years. So whenever you find time to contribute in the form of questions or some classes that you can take for the students in online, and they will be really motivated, because the way you could convey will be making a different impact. Then definitely the faculties are doing their job, but they are 2 to 3 years or 4 years from the exam, from today exam. They give you all the facts and all the concepts that are required, but you have gone through the exam and have been successful.
Real scenario. It gives us a real scenario.
Yeah, real scenario. So I invite you to join SPEED as a faculty. And you have been as a student in postgraduate entrance exam and now in SS, and definitely you will have an attachment to this institute. Definitely it will be there. So, and because being a part of the journey through, the entire two important exams in life. So if you could join us and be in a place where academics are happening on daily basis, and it will be great to have you with us.
Sure, sir.
Okay. So, and once again, I bring all the wishes from SPEED Institute to you. God has given you what that you wanted, and definitely more blessings to you and to your family. And we wholeheartedly wish all the best and all the success in your entire career as an MCH gynae-oncologist, and to serve the people that you wanted to do in this specialty. I hope definitely the patients will get benefited out of your years to come, and definitely be in touch with us, and definitely be a part of a faculty team with us to help more students in the same specialty. So the knowledge that you have learned could also be transferred to the next generation.
Sure, sir. Thanks a lot, sir.
Thank you very much. God bless you. Thank you very much.
Thank you.